So I will be performing the oral facial examination on Laura. We're gonna start with if there's any droopings on the corner of her mouth. So I don't see any, so I'll mark that as no. Is our eyelids partially or completely closed? No. Is the mandible or jaw drooping on one side? No. Are there any abnormal movements such as spasm or twitching? No. Is there any sign of mouth breathing or drooling? No. And now we're looking at the symmetry of the face. Does the corner of the mouth deviate on one side? No. And I'll be asking her to open her mouth wide, just ah. Okay, thank you. And it doesn't seem to deviate on one side, so I'll put no for that one. And I'll check if her eyebrows are raised evenly. So if you would raise both eyebrows. Okay, thank you. So it's a no. Can you close both of your eyes tightly, please? Okay, thank you. And they close evenly, so there's no concerns there. So now I'm gonna look for the structure and functions of her lip. I don't see any drooping from any corner of mouth, so I'll mark no. Is there adequate amount of tissue in her lip? I'll put yes. Do the lips remain closed or apart while rest? Yes, they do. Are there any signs of mouth breathing or mouth drooling? No. Do the lip tissues appear healthy? Yes. And is there any evidence of a repaired cleft lip or any scar tissue? And you stated yes. So now we're looking for the functional integrity of our lips. So I'll ask you to smile. Okay, thank you. And it doesn't show any deviation to one side. I'll ask you to pucker your lip. Thank you. And it doesn't show any favor on one side. And then I'll ask you to alternate between puckering your lip and smile, please. Okay, thank you. And those appear perfectly normal. So I'll ask you to hold air in your cheeks for about 5 counts. Okay, whenever you're ready, go. 1, 2, 3, 4, 5. And she does it perfectly fine, so no problems there. Oh, I forgot to put the mirror underneath, but you did it perfectly fine. So okay, should we try to test it with the mirror anyways? Sure. Okay. Do you want to hold it under yourself, and then I'll ask you to 5 counts and then check if there's any. Okay, go ahead whenever you're ready. 1, 2, 3, 4, 5. Okay, thank you. And that's perfectly normal as well. I'll ask you to say ooh ee in alterations, and I'll watch if your lips move appropriately. Go ahead.
Ooh ee.
Okay, thank you. And they're perfectly fine. So now what I'm looking for is the structure and function of your tongue. So if you don't mind sticking out your tongue, I'll check the color if it's normal. Okay, thank you. Looks perfectly fine. And the size of your tongue is normal as well. Is there any sign of muscle atrophy or muscle loss? It doesn't appear that way. It didn't show any abnormal movements or spasm when you stuck your tongue out, so it's normal. So now we're looking for the integrity of your tongue. So I'll ask you to protrude your tongue as far as possible, please. Okay, thank you. And it looks perfectly fine. And when you retracted your tongue, it looks normal. it didn't seem any deviation to one side, so it's also normal. Can I ask you to protrude your tongue for at least 5 counts? So I'll be counting to 5 and you just leave it sticking up for 5 seconds, okay? Whenever you're ready. 1, 2, 3, 4, 5. Okay, thank you. So that was perfectly normal. And you could do it perfectly fine without resting it. It doesn't hang over the lower lip, so it's perfectly fine. So what I'm gonna have you do for the next part is protrude your tongue out, and I'll ask you to move it up, down, left, right as quickly as you can, and I'll check for the range of motion and if there's any sign of uncoordination or weakness, okay? When you're ready.
Okay.
Up.
Down, left, right?
Yes.
Okay.
Up, down, left, right. Perfect. And everything was perfectly normal, no signs of weakness. And when you retract your tongue, it was also perfectly normal. And can I also ask you to lift your tongue so I could check underneath your tongue, please? Okay, thank you. Perfectly normal. And can you say la 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 so that I'll check your range of motion, your strength, and your execution, please?
La 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 la.
Perfect. And I could see your tongue perfectly fine. And I'll have you say ka 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 ka.
Ka 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 ka.
Perfect. And then I'll have you say ka 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 la.
Ka 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 la.
Perfect. So now I'll be checking your hard palate. So I'll just have you open your mouth wide and I'll check your hard palate to see if the midline is normal. I'll also be checking the height and the width of the hard palate to see if it's normal. And let's see if there's any sign of cleft or fissures that are repaired or unrepaired, and I'll also check for any surgical removals of any hard palate or any prosthesis, okay?
Okay.
If you don't mind me opening your mouth, and I'll check on top. Okay. Thank you. Everything seems perfectly normal over there. Okay, so now we're gonna check the soft palate. So I'll check if the color is correct. It will be like a whitish pinkish color. I'll check the uvula if it's a bifid uvula. I'll also check if there's any repairs, any surgical removal, any prosthesis. Does the velum seem symmetrical and the length of the velum? And for adequate movements. Okay, so I'll be looking at your soft palate, please. Okay, thank you. It looks perfectly fine in all areas. Okay, now we will look for the functional integrity of the soft palate. You do not, so I'll be checking if you have a hypernasal or hyponasal speech. From speaking to you, you do not, so I'll just mark that as no. Is there any unusual substitutions such as pharyngeal fricatives and glottal stops for pressure consonants? No, there's nothing unusual. And what I'll be doing is I'll be checking the back of your velum movement wall. So I'll ask you to say ah and check.
Okay.
So, and I also need you to say it a few times for repetition to make sure that the velum moves up and back to meet the pharyngeal wall. So let's check for that.
Okay. Ah, ah, ah.
Okay, perfect. And everything seems to be functioning normally. Okay. And let's see. I'll ask you to produce isolated sounds, syllables, or word loaded with non-nasal sounds while placing a mirror under the nostrils. So I'll have to place this mirror under your nostrils again, and I'll ask you to say words that do not contain any nasal sounds. So I think I remember watching Bookcase. Can you say bookcase just maybe 3 times, and I'll just check for any.
Bookcase?
Yes.
Okay. Bookcase. Bookcase. Bookcase.
Okay, this looks perfectly normal. There wasn't any fogging of the nasal. So now I'll be looking at your teeth structures. Teeth structures, if you have any jumbo teeth, partially missing teeth, dentures, or braces in place. So can you just open your mouth, and everything seems normal. Nothing of the unordinary. So no missing teeth, nothing, no braces. Okay. And I'll ask you to bite gently down on the lips so the teeth could be observed. So you can just, it just says to bite down gently and separate. Oh, it's bite down, separate the lips. So this. Okay, thank you. No more occlusions. Oh, sorry. Molar occlusion relationship is all normal. Relationship to it's a overbite, and the general condition of the teeth. It looks fine. Healthy. It looks all normal. Okay. And now the last part, we're just gonna have to use the timer, and I'll ask you to say pa 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 20 times, and then I'll stop it after I count to 20.
Okay.
Okay. Whenever you're ready.
Pa pa pa.
Okay, yes.
Pa pa pa. 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 Pa pa pa.
Okay, so she ended with 17.5 seconds. Okay, reset. And then now I'll ask you to say ta ta ta. And I'll ask you to say it 20 times.
Okay.
Okay, whenever you're ready.
Ta ta ta. 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 Ta ta ta.
14 seconds. 14.2. And now I'll ask you to say ka ka ka.
Ka ka ka.
Yes, 20 times. Whenever ready.
Ka ka ka. 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 Ka ka ka.
So it's also 14.3 seconds. I think we might have started a little bit late on the first one. It's okay. And now be fa fa fa.
Fa fa fa.
Whenever you're ready.
Fa fa fa. 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 Fa fa fa.
13.6. And now this one is la la la. Okay? Are you ready?
La 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 la.
This is 13.2 seconds. And now the last one I'll be asking you to do is pataka.
Pataka.
Okay? Whenever you're ready.
Pataka. Pataka, 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 pataka.
Okay, 13.8. And that concludes the oral facial examination since there's no other comments and everything's perfectly normal.
Okay.